everyone to our SLP Masterclass Comprehensive Pediatric Assessments in Speech and Language Pathology. I'm Kate.
I'm Amy.
And we are your course instructors. The purpose of this video is to just give you a brief review of what we're going to cover in this course. So slightly more in-depth introduction. My name is Kate Granbois, and I am a dually certified speech language pathologist and board certified behavior analyst. I have a little over 15 years of clinical experience, and I've worked in a variety of different workplace settings. I've worked in private practice, outpatient, private clinics, and private schools. I've been in private practice for about 10 years, working primarily as an AAC specialist, and I put that in quotes because it is not a real job title, or it's not a real certification. It's not a real thing. It's my job title. And I am co-founder of SLP Nerdcast with my friend Amy here. My financial disclosures. So I am the owner and founder of Granbois Therapy and Consulting LLC, which is the name of my private practice. And as I already mentioned, I'm a co-founder of SLP Nerdcast. My non-financial disclosures, I'm a member of ASHA CEUs 12, and I serve on the AAC advisory group for Massachusetts Advocates for Children. I'm also a member of the Berkshire Association for Behavior Analysis and Therapy, MassABA, the Association for Behavior Analysis International, and the corresponding Speech Pathology and Applied Behavior Analysis Special Interest Group.
Hello, everyone. I'm Amy Wonka. I have been a speech language pathologist since 2005, which is a long time when you do that math. I have also worked in a number of different settings, primarily schools, but also outpatient clinics, private practice, both public and non-public special education schools. I also have the job title of AAC specialist and am co-founder of SLP Nerdcast. So for my financial disclosures, I'm an employee of a public school system and co-founder of SLP Nerdcast. And non-financial disclosures are that I am a member of ASHA CEUs 12, and I also serve on the AAC advisory group for Massachusetts Advocates for Children.
So why make this course? Research tells us that as SLPs, we rely heavily on standardized assessments, even though the samples in standardized assessments are often very biased. Not to mention, for our more complex learners, they are not represented in those samples. Standardized tests are not designed to measure individual changes in functional communication. So when we use them or over-rely on them when we evaluate our more complex learners, we often don't measure skills that are meaningful to our clients. So then the question becomes, what can we do as clinicians to conduct and write better assessments? The answer to that question is rooted in our why. Why are we assessing our students and clients? Is it for eligibility of services? Is it for insurance purposes? Is it their first evaluation? Is it to measure progress? Your why will dictate what tools you use to make sure that your assessment is as comprehensive as possible. Lastly, there are many valid methods of assessment outside of the standardized test that are really important for us to know about, especially when we are assessing more complex learners. In this course, we're going to review all of these concepts in more detail, and we're also going to review the different methods of assessment and review the pros and cons of each. We're going to wrap up the course with a final week talking about information management and documentation strategies to give you a more comprehensive perspective on how to conduct more comprehensive speech and language evaluations.
Yes, and to do that in a way that is also time efficient and productive, which I think is also a challenge for so many of us who are trying to do as much as we can in a small amount of time. Mm-hmm. And what we're going to talk about in this course, what will you take away? The knowledge and skills. We're going to go over the fundamental components of a comprehensive speech and language assessment in pediatrics. We'll talk about the pros and cons of different assessment methods, including norm referenced assessments, criterion referenced assessments, standardized assessments, dynamic assessments, informal and customized assessments, as well as the components of a comprehensive assessment documentation. And, you know, these are all pieces that come together to allow us to make good choices about the tools that we're going to use to answer those clinical questions that Kate was talking about.
We're also going to identify assessment measures that are most appropriate for your specific student or client. We're going to talk about that through the lens of designing customized assessments and procedures that are that are designed to better support your student or client. And we're going to talk about interpreting and reporting assessment modifications for individuals with complex communication needs.
And we're also going to talk and do some work around understanding the impact of client, family, and stakeholder perspectives and values within the assessment procedures themselves, to gain a better understanding of the importance of assessment documentation and the effect that has on treatment outcomes, to consider ethical responsibilities when designing assessment procedures, and to consider the relationship between ethics, evidence, and assessment procedures.
The ethics part is one of my favorite parts because it's really one of the major underpinnings of why we do these assessments, and it's not something that gets discussed often enough, in my very humble opinion. So I'm looking forward to discussing that.
It's a really important piece.
So what comes next? So your next steps as a student in this course are to locate your syllabus and familiarize yourself with it. The syllabus is going to be your primary set of directions, if you will, for how to navigate through the rest of this course. We also encourage you to familiarize yourself with the discussion board feature of this course and tinker around with our technology and software. Make sure you're comfortable with it so that as you move through each week in the course, you have an opportunity to focus on the content and avoid any technical issues or difficulties. There's also an instructional video available during the orientation period that we also, if you haven't watched already, we encourage you to watch that as well. If you do have any issues with technology or our software, shoot us an email right away. We're happy to help you. And finally, this week, before you move on to your next components of the course, if you haven't done so already, please make sure that you introduce yourself to the rest of the cohort. Part of the requirements for this course is an online discussion board post. And we are really excited to create that nice cohort atmosphere. And the best way to do that is to introduce yourself and say hello. So don't be shy.
Welcome to the class.